Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Board of Commissioners. I'm here today with our Vice Chair, Commissioner Ken Lawrence. Today is Wednesday, November the 18th. We are week 37 in the pandemic here in Montgomery County. Since our November 17th press release, we have had 225 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 17,355. These positive cases are a result of a positive test for the virus, not from the antibody test. 4 of these cases are from long-term care facilities. 221 are from the community. 214 tests are from the last 7 days or less. 9 tests are from 8 to 14 days ago, and 1 test is from more than 14 days ago, and 1 has an unknown date. These positive individuals are from 43 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 2 years old to 100 years old. As always, you can check our county map at montcopa.org/COVID-19 for updated geographic and age and other information. Today we have 118 females, 105 males, and 2 unknown. I am sorry to confirm that 3 additional Montgomery County residents have lost their life to COVID-19, which brings us to 857 deaths confirmed positive from COVID-19. All 3 individuals passed away in a hospital. They ranged in age from 80 to 91 years old. Overall, we have lost 453 females and 404 males since the pandemic began here in the county, and they ranged in age from 36 years old to 104 years old. In terms of self-reported racial breakdown of individuals who are deceased from COVID-19, and we do occasionally report this when we have the data available, 20 Asian, 3 Asian Indian, 3 Asian Korean, 107 African American or Black, 348 white, and 376 unknown. The fall surge in COVID-19 cases continues here in Montgomery County and across southeastern Pennsylvania. We remain in a period of rapidly escalating cases and hospitalizations. And sadly, we are beginning to see an increase in deaths. By working together, we have the power to suppress this virus. We did it in the spring, and the impact of that shared sacrifice and personal responsibility got us through the summer and into the fall. Working together, we have the collective power to keep this virus suppressed, protect our hospitals, enable our children to attend school, and keep businesses open. If we do not work together, the outcome is clear. The virus will win. Our positivity rate is increasing. Our 14-day average positivity rate is now 7.04% as of Friday, November the 13th, compared with 5.45% on Saturday, November the 7th. As a reminder, a positivity rate below 5% is considered suppression of the virus. Just a reminder, the graph that you're looking at, the prior graph showed the number of tests in the orange line on any given day, and then what percent of those tests were positive. So moving on to the daily positivity graph, this graph runs from October the 31st to November the 13th and shows that the county is above 5% on 12 of those days. So this is certainly not the direction in which we want to be moving. Our hospitalizations continue to increase. Today, we have 221 individuals with COVID-19 hospitalized in a Montgomery County hospital. That's an increase of 50 individuals from last Thursday, and an increase of 120, that's 120, from 2 weeks ago. 13% or 47 of these individuals are requiring a ventilator. As a reminder, both hospitalizations and deaths do lag behind cases. If case numbers continue to rise, we will continue to see an increase in hospitalizations and eventually an increase in deaths. We have now added information on daily hospitalizations and ventilator use to our data hub at montcopa.org/COVID-19. People are asking every day, why is this happening? And there are many factors, but cooler weather is certainly one of them. The virus can stay airborne longer in colder, drier air, so it has more opportunity to infect someone. And second, cooler temperatures are sending people indoors for gatherings. Private social gatherings and sports and recreational activities continue to be our biggest centers of transmission, but we are now seeing viral spread throughout our community. I want to give a school update. The county has been tracking positive students since September the 7th. As of Monday, 2 days ago, we have 378 students test positive for COVID-19 this fall. This is an increase of 110 students from last week. 180 of these students are from religiously affiliated or independent schools. 198 are from public schools. We also have 138 staff who have tested positive, which is an increase of 38 since last week. As of today, we have 5 instances of linked transmission within schools. That means that virus was spread within the school day. And we have 2 more likely instances that are currently being investigated. Additionally, 2 school districts have significant outbreaks among their bus drivers. So currently, we have 1 public school district closed due to linked transmission within several of their schools. We have 2 religiously affiliated schools that are closed due to large numbers of positive students within those schools. One of those 2 schools has linked transmission through sports. And we have 1 independent school closed due to large numbers of positive students. Then we have 2 closed schools, or 2 entities closed with what's called a functional closure. This means that they don't have enough staff or adequate staff to safely open. One of those is a public school district. The other is a program, a specialized program within a public school. I want to clarify an issue that has caused quite a bit of confusion in the public around the Montgomery County Board of Health's order, the Montgomery County School COVID-19 Risk Reduction and Mitigation Order. This is the order that requires all schools in the county to offer 100% virtual education from Monday, the 23rd of November through Sunday, December the 6th. The order as passed allows schools to offer the educational method or methods they choose beginning on Monday, December the 7th. Resuming in-person education does not require any vote or any other action by the Montgomery County Board of Health. Should the Board of Health feel it is necessary to change this order, a special meeting will be called for this purpose. No special meeting has been scheduled. The December 2nd meeting of the Montgomery County Board of Health is a regularly scheduled meeting, and this issue is not on the agenda. I want to reiterate, resuming in-person education on Monday, December the 7th does not require any vote or other action by the Montgomery County Board of Health. As we continue to navigate this very challenging situation, we have received some additional good news this week. It now appears that there will be at least 2 highly effective vaccines that will begin to be available in limited quantities by the first of the year. I also want to remind people that a week ago, the CDC confirmed the effectiveness of cloth masks to both prevent transmission of coronavirus and reduce the likelihood of an infection from coronavirus. In other words, both people wearing masks are protected. Masks are particularly important for asymptomatic people who feel well, who feel perfectly fine, and may be unaware that they are infectious to others. People who feel fine and have no symptoms are estimated by the CDC to account for more than 50% of transmissions. I'm just going to say that one more time. People who feel fine and have no symptoms are estimated to account for more than 50% of transmissions. This is why it is so important to wear masks. As we stare down this surge, keep this hopeful news in mind. There will be an end to this, but we have a number of months to get through before we can begin to return to our pre-COVID lives. Our goals for the next several months are to protect our hospitals and first responders. For those elected school boards across the county that vote to offer in-school education, keep our positivity rate and incidence rate of new cases as low as possible to minimize risk for students, teachers, support staff, and the bus drivers in our schools. Continue to allow businesses that are operating safely, are following all mitigation measures, and are not sites of COVID transmission to continue to operate. I hope that you share these goals, because these goals will not be met without cooperation from every person in this county. And that brings me to Thanksgiving. I know we are all looking forward to Thanksgiving, but it does need to be a little different this year. We are asking you not to host an indoor Thanksgiving celebration with anyone outside of your household or family bubble. Because of the large increase in cases following Halloween parties, we are extremely concerned about Thanksgiving gatherings. Our Office of Public Health has posted guidance and ideas about how to make this Thanksgiving still feel special at www.montcopa.org/Thanksgiving guidance. And you can see a screenshot of some of that guidance right now. Additionally, if you are able to work from home, please do so as much as possible. We are starting to see more transmission in various workplace settings. Do not carpool unless you drive with the windows open and every person in the car has on a mask for the entire drive. Carpools are places where we have seen transmission. And please limit your non-essential trips and travel. Do not leave home without a mask, and make sure it's on whenever you are within 6 feet of someone who is not in your household. And if you are indoors, you need to follow the new guidance from the state, which I fully support, which if you are within the same room of anyone indoors, even if you're more than 6 feet apart, everyone should have a mask on. Keep your hands clean and away from your face. Get tested, and I'll talk a little bit more about testing in a minute. And it's so important to cooperate with contact tracing. And I'll also give an update on that. And then if you haven't done it yet, please download the COVID Alert PA app. This is a tool that can greatly assist contact tracing should you test positive or someone that you were nearby test positive as well. So some updates on contact tracing. Due to the large volume of cases, the contact tracing team is prioritizing contact tracing in the following way. And this prioritization is aligned with guidance from the Pennsylvania Department of Health. We are prioritizing persons 18 years of age and younger, persons 65 years of age and older, and persons who are part of a community or household cluster. Also, if you were exposed at a school, through a sports team, or at your workplace and need to quarantine, your initial contact from the contact tracing team is now likely to be by email rather than a phone call. So these are not for individuals that are positive. These are individuals who've been exposed to someone who has now tested positive. If you believe you may have been exposed through one of these locations, please check your email regularly. Currently, the contact tracing team has 62 members, and we are continually adding more. When it comes to testing, we continue to have strong availability of testing, but that testing is becoming very popular. So I do want to continue anyone who wants or needs to be tested to get tested, but you may have to have some patience there, and you may not get in on the day that is of your first choice. We have been asked by our Montgomery County hospitals to remind you of the following: that hospital emergency rooms are not to be used for COVID-19 testing. They are to be used if you're sick, whether you think it's from COVID or any other serious medical condition, but you should not be going to a hospital emergency room simply to be tested for COVID-19. Please use a county testing site or one of the many private sites in the county. Now, about being tested. If you know that you've been exposed to COVID-19, you should self-quarantine for 14 days. And if you would like to be tested, which is fine, you need to wait until 5 to 7 days have passed since the exposure. So let me repeat that. If you know you've been exposed to COVID-19, you need to quarantine for 14 days. And if you would like to be tested, you need to wait 5 to 7 days since the exposure. If you get tested more quickly than that, the test may not be reliable. And as a reminder, even if you test negative after 5 to 7 days after exposure, you still must complete the 14 days of quarantine. As I mentioned, we do know that the county's testing sites are being very well utilized right now, and we're working as quickly as we can to increase the hours that each of these sites operates. We hope to be able to announce an expansion of hours very soon. In the meantime, please make an appointment. We cannot promise that we will be able to test you without an appointment. I also want to give you a heads up that county testing sites will be closed on Thanksgiving Day, but they will be open on the Friday after Thanksgiving. To register for a test, as a reminder, you can go online at montcopa.org/COVID-19, click on the green County Testing Information button. And appointments open at 8:30 a.m. on the day of testing. You cannot book ahead. You can also make an appointment by phone. The phone appointments also open at 8:30 in the morning. And that phone number is 610-970-2937. For the 14-day period ending November the 13th, 44,985 Montgomery County residents were tested, which is an increase of 5,423 people tested compared with the 14-day period ending November 7th. So that does give you a sense of why our testing appointments are going quickly. So now we'll move to our date tested graph. As a reminder, this shows the number of people who were tested on any given day by the gray bars that you can see in the background, and then the number of people who tested positive on those days represented by either 7-day or 14-day running averages. You can see at both our 7-day, which are the darker blue and red lines, and our 14-day, which are the pinker and lighter blue lines. Both of those running averages have now far surpassed the peak that we saw in those same numbers this past spring. So the cases are rising much more rapidly than we saw in the spring. And this is obviously continuing to be a very rapidly evolving situation. Now, I do want to remind everybody that we have one more flu clinic. We have 6 walk-up flu clinics, and they will all be open tomorrow, Thursday, in Pottstown, Green Lane, Willow Grove, Lansdale, Norristown, and Ardmore. And again, please note this is the final day for the county walk-up flu clinics. The flu shots are offered at no cost to individuals aged 6 months and older who live, work, or go to school in Montgomery County. Appointments are required for all locations. To make an appointment, visit montcopa.org/flu or call 610-278-5145. It is particularly important to get the flu vaccine this year, because if you are vaccinated for the flu, you are less likely to get the flu. And if you do get the flu, you are much less likely to require hospitalization. So this is another step that we can all take to help protect the availability of hospital beds here in Montgomery County. So just remember, please, we remain in a serious and rapidly evolving situation. If we work together, I know that we can suppress this virus. I know this because we did it before in the spring, and we can do it again. Together, we have the power to keep this virus in check while we await the arrival of vaccine or additional treatment options in our community. Please choose the path of making safe choices. Know that you are not the only person making sacrifices. And please show compassion and kindness to everyone in our community. Let us stand united in this fight so that we can beat this virus. And with that, I'll turn over to Commissioner Lawrence. Ken, you're muted.
You hear me now?
Yes.
Okay. Thank you. I'll start again. As Val mentioned, we are in week 37 of this. What began as days of social distancing have become weeks and have become months. And many of us are experiencing a greater and greater sense of isolation. We're all concerned about our parents, our children, family, and friends. We're also dealing with the uncertainty of when and how this pandemic will end, despite the positive news on the vaccines. We are all dealing with the fear of becoming infected. We are all dealing with the economic crisis and the inconsistent messaging about the virus across multiple platforms. And at the same time, we're seeing a surge of COVID-19 cases as another set of holidays, beginning with Thanksgiving, come where we are all used to gathering together as family. So with so many concerns and so many restrictions, we also have to be concerned about a spike in mental health. And we talked about this, quite frankly, a lot more earlier on in the pandemic and have gotten away from it. But I do want to share some resources for those who are concerned for themselves or concerned for their family members. The Montco Department of Human Services, DHS, and the Center for Community Resources, CCR, is always there to help and has created a new statewide support and referral helpline. It's available 24/7 to respond to those struggling with anxiety and other emotions due to the COVID-19 emergency. The mental health support line can be reached toll-free at 1-855 284-2494. And another great resource is the Montgomery County Mobile Crisis Support Unit, which is also available 24/7 for anyone experiencing depression, suicidal thoughts, and it also provides peer and teen support services. So you can call 1-855-634-4673 or visit www.accessservices.org for more information. So as we approach Thanksgiving, and Val mentioned that, let's make sure we stay in touch with our friends and our loved ones in the safest way possible, whether it's Zoom, FaceTime, Skype, or just a plain old phone call. Please reach out to someone this weekend and check in and during next week and on the holiday. It was 32 degrees this morning. It was below freezing. Winter is here. Temperatures are dropping, and we recognize that there are many in our communities who struggle to find adequate food and housing. And we've said since the beginning of this pandemic, if it was tough before the pandemic, it has not become easier for those who are food insecure or those who are homeless. The need is greater than ever, and the demands on the safety net organizations have skyrocketed. According to a 2018 Feeding America study, 9.5% of Monco residents are food insecure, and 12% of those are children. Over 51,000 Monco PA residents are receiving benefits from the Supplemental Nutrition Program, SNAP. But due to the COVID-19 pandemic, we know that those numbers have grown. So far this year, the 34 Monco Anti-Hunger Network member food pantries have seen a tremendous increase in volume, in some cases double or triple their ordinary demands, especially when non-essential businesses were shut down. The recovery from the COVID-19 pandemic, along with the economic consequences, could take years, putting an even greater strain on these resources. We need your help to help these vulnerable families, individuals, and children to make sure they have enough nutritious food to eat and protective shelter in the coming harsh weather months. So here's what you can do. If you're able, you can make monetary donations towards food online or by check to the Monco Anti-Hunger Network. They will use the money to purchase food for local pantries. You can visit www.moncoantihunger.org for more information. We will also be collecting canned food donations in the lobby of One Montgomery Plaza as part of the annual Lieutenant Patty Simons Food Drive, which runs now through December 16th. Each year, this event has collected over 2 tons of food for those in need. You can volunteer to provide meal deliveries and stock food pantries by contacting RSVP at 610-834-1040 or email Kathy S. at rsvpmc.org. All food providers are practicing heightened hygiene practices, such as staying home when sick, modifying routes to use fewer volunteers, and providing frozen meals. And finally, homelessness. Your Way Home, our anti-homelessness agency, has launched a Gift of Warmth campaign to make sure that no child under 5 years old, no pregnant women, and no medically fragile individuals ever sleep outside. They are always in need of donations to provide blankets, coats, socks, medical supplies, and other basic needs for individuals experiencing homelessness in Montgomery County. Housing homeless individuals in shelters is especially tough during the COVID-19 pandemic, because it can be tough to socially isolate or quarantine residents. So donations also go to help find hotel accommodations so that our shelters are not full. And you can visit www.yourwayhome.org/donate to find more information about these programs and to donate. That concludes my report, Val.
Thank you, Ken. With that, I will note that our next virtual briefing will be on Tuesday, November the 24th at 3 p.m., and I'll be happy to take questions.
This afternoon, we'll start our questions with Jim Melwork from KYW. You mentioned flattening the curve in the spring, but there were restrictions in place then. And with Pennsylvania Department of Health saying they favor local control and the graph you showed, do you think those local restrictions would or could be as effective as statewide? And aside from schools, are you considering any restrictions at this time?
Well, it's important that people understand that we are consistently taking a look at businesses and other places where we have gotten reports that entities are not following the mitigation measures, or where contact tracing has shown us that there's been an outbreak. So we have had some restaurants that have had to close on a temporary basis. We've had some other locations that have had to close, some for as long as 2 weeks, depending upon the circumstances. So we are trying to balance the livelihood of so many people in our community who own many of these small businesses and in full compliance with all guidance, and requiring others to close. So we're trying to get that balance, right. I think in general that it is helpful to have a regional approach to these issues. And we are waiting to see if there are additional, more region-wide measures that the state does intend to take. I'm not aware of any. But for now, we will continue as we are, but we are monitoring the situation very, very carefully.
Todd, if you want to go down the list, I can come back later.
Okay, thanks, Jim. Next, we'll go to Deanna Durante from NBC 10.
Does this mean I can only ask one question, like Jim? Or how many can I ask so I can prioritize?
There is no limit to the number of questions, Deanna.
Okay, so piggybacking off of what Jim said there, you talk about favoring a regional approach. Philadelphia said that it hopes that surrounding counties join them in the measures that they have taken. Is that a conversation you're having with Philadelphia to further restrict dining? And then when you look further out in the region, I mentioned this before, our other counties, Chester, Bucks, Delaware County, say they have no plans to do the school mitigation efforts the way that you have done. So then how does that work for a regional approach if you all have differing views on what should happen next?
Well, we have not had that conversation with Philadelphia. I can't speak as to whether or not any of the other counties have. And for now, this is where we are at. I think each county is in a little bit different place at the moment, and each county has made decisions. Well, I don't want to speak for how they've made decisions, but we have made decisions here in Montgomery County based on our data, our contact tracing, and what we have learned over the last 30 tends to behave in our community.
You mentioned if you know you're exposed, not to get a test right away, quarantine, get that test 5 to 7 days. Are you seeing that people are using that test as a false sense of security and then going out into the public, getting a rapid test the first day and then just not quarantining? Is that the reason you bring that up?
So 2 reasons. First of all, a lot of our hospitals and medical providers, doctors' offices and others are getting phone calls from patients who say, oh, I just found out that yesterday I was exposed to someone who's now positive. I need to be tested. So we just want to make sure that people don't need to make that phone call. They can just wait 5 to 7 days and then sign up to get tested wherever they would like to be tested. So that's part one. Part two, though, is to echo just what you said, which is that even if you get a negative test at day 5 to 7, that it doesn't become infectious and might eventually test positive a few days later. So we do require that people continue to quarantine for that full 14 days. But if you do want to get tested, it can certainly let you know about any risk that anyone else in your household or others that you might have been around would be subjected to.
You talked about priority contact tracing with certain age groups. Is that because you have a backlog of people to get in touch with? Where are you with that? How is that going?
I believe I did make it clear that because of the large numbers of cases that we're experiencing, we are prioritizing the phone calls, who's getting the phone calls and the order at which that they're getting them. And then we have also shifted for those that need to be notified of the need to quarantine to an email notification in a number of situations.
Okay. Are you aware late this afternoon of a lawsuit that was filed against Montgomery County and the Board of Health alleging that the Board of Health violated the sunshine laws in terms of your health department order to put all schools in that virtual platform surrounding Thanksgiving and after?
I was informed by our solicitor right before this briefing started that a lawsuit had been filed. He is reviewing it, and I don't have any of the specifics.
All of you run public meetings. Do you think that the way it was done was legal? Because some of the parents say they didn't have any warning or posting about it. They couldn't find it on the calendars. They only found out about the meeting because they got letters from their school superintendent saying that this was a possibility.
I can't actually speak to how that meeting was run. As you recall, the commissioners were all in an election board meeting, so I didn't see it. That's all I can say about it.
Okay, so I will tell you that in the first meeting on Thursday, at least one school said that they still don't even have their Chromebooks yet to be able to go to a virtual learning platform. Is the county reaching out to districts that need supplies? How are you helping to make this happen so that they are able to at least try and educate some of the children within the district?
Well, you may recall that the county granted a total of $15 million to all of our public school districts, and even additional dollars above that 15 to the Boyerton School District, since although they're based in Berks County, a large number of their students live in Montgomery County. And we gifted that money to the schools for just this purpose. They were able to use that money for technology platforms, for PPE, for other equipment to help make their schools safe. There was a very extensive list of items that the schools could use that money for. That money was allocated using the federal Title I federal funding formula. So that formula includes amounts of poverty in a given school district, so that we were able to direct those dollars to where the need was greatest. So I can't speak to what each particular school or school district did with those funds, but we did make a significant amount of dollars available to them. And I have not had any of them come back saying that they could use a specific additional allocation for something else.
Well, one of the schools did comment, and it's a private school that commented on the Zoom with the health department, saying that they ordered their supplies in July, their Chromebooks, so they don't even have enough Chromebooks to give the kids to try and do virtual learning. So the money is good, but we all know who's got their Lysol wipes and their toilet paper at this point. So if you can't get it, the money doesn't help if they physically can't get these things to give to their students. Yeah. So where do they go from here?
Well, we have not been working as closely with private schools on this particular aspect of the preparedness. So I really can't speak to that, Deanna. I have no knowledge of the circumstances of that situation. I'm sorry.
Okay, thank you.
Next, we'll go to Julie Jang from Korean Philadelphia Times. Julie, you're muted right now if you are asking the commissioners a question. Okay, for now, we'll move on to Carl Hessler from the Pottstown Mercury.
Good afternoon, commissioners. In the spring, you had to make, you ended up having to get some surge capacity for hospitalizations. And I'm wondering, I think at that time there were about more than 400 people hospitalized. With the hospitalizations going up now at this rate, and I think you said there were 221 as of today, is there any thought to the county having to get surge capacity again for hospitalizations?
So we are in regular communication with our hospitals, and what we are beginning to explore now at the request of at least one of our hospitals is capacity for people who are ready to be discharged from the hospital. They don't require hospital level care, but they need some convalescent type of care. And that seems to be a bit of a bottleneck right now. And so we're just in the very early days of that, but we're exploring whether or not we might be able to assist with the standing up of some kind of a initial discharge facility for people that don't need to be in the hospital, but maybe need just a few more days of assistance.
Okay, and one other question, are you hearing of any hospitals that have any unmet needs as of today?
Not in Montgomery County. I've not been informed of any unmet needs.
Okay, thank you. That's it.
Thank you, Carl.
Our next reporter will be Ellie Rushing from the Philadelphia Inquirer.
Thanks. I don't have questions. You can go to my colleague, Tom. He has a better question from the Inquirer.
Okay, thanks, Ellie. We will pass it on to Tom Averill from the Philadelphia Inquirer.
There we go. Sorry about that. I can't promise that my question will be any better than Ellie's, but given I realize what you said about the fact that hospitalizations and deaths will lag behind cases, but even as accounting for that, it still seems as if we're well below the mortality rate of the spring, in both here and elsewhere. Do you have any sense for the various reasons that might be true?
Yeah. So the lag issue is certainly a real one. And that was absolutely what we saw in the spring. And it was really 3 to 4 weeks after it started before we started to really see substantial increases in deaths. But, I am hopeful that we are not going to see nearly as many lives lost this. One is that we are seeing the average age of the individuals being hospitalized is coming down. In the spring, the situation with the long-term care facilities was really quite dire. You can see that on that graph that we showed with the date tested that in the spring, we had large numbers of long-term care facility individuals hospitalized. Now we have hardly any. So because of that, the average age of the people being hospitalized is coming down. Yeah, could you maybe throw that back up, Todd, and I'll show you what I'm talking about. On this graph, the long-term care facilities are represented by the yellow and orange line. Those are the 7 and 14-day averages. And you can see what it looked like back in the spring, and you can see what it looks like now. Basically, I'm sure he'll get it up in a second, basically a flat line. So what I'm hearing from our hospital partners is that the average age of individuals hospitalized is lower than it was in the spring. And so hopefully the risk of death is lower with the younger age group. But they are seeing people in sort of mid to late 20s and on up being hospitalized in Montgomery County hospitals. The second thing is that we're a lot better at treating this disease. So our doctors and nurses and hospitals understand what works best. I think particularly when it comes to how to help these patients breathe and stay well oxygenated. There's an understanding now that many other steps can be taken before putting an individual on a ventilator, and those steps are quite successful in many cases. And we also have some treatments now that we did not have in the spring. So none of these treatments could be considered a cure, but there are medications out there. There was a monoclonal antibody medication approved a week or maybe 10 days ago now. But so there are some new medications out there that will reduce the severity of someone's particular case of COVID-19, and in so doing, reduce the risk of death. So I'm sure hoping that we don't see anything like what we saw back in the spring. That does remain to be seen, and I don't think we'll know the answer to that for at least probably another 3 or 4 weeks.
Thank you.
Thank you.
Next, we'll start our second and final round of questioning here for our reporters. We do have some time constraints today for the commissioners, so we'll start with Jim Melwert.
I'm just looking at an email from the State Department of Health where they say 25% of all statewide cases had contact tracing case investigation started within 24 hours of receiving the positive report. 25%, you mentioned you had to prioritize. Is that, if from a public health standpoint, with your background, is it effective when contact tracing is only reaching a quarter of positive cases?
Well, first of all, I don't know what our number here exactly is in Montgomery County, but I believe it is higher than that. So remember, that's a statewide number, and the state is providing contact tracing for every county that does not have a health department. So it's a very diverse situation. Ideally, you want to contact people as quickly as possible. Our lab does have a patient portal, and everyone is encouraged to sign up for that and check that patient portal. And that patient portal is populated very quickly once the test is run. So people can often find out fairly quickly that they've tested positive if they were tested. Go into isolation. They're given information at the testing site about what to do if they test positive. So even before they get the call, sometimes they can find out and begin their period of isolation. We want to identify these people as quickly as possible. That's another reason why every week I ask people to download the COVID Alert PA app. That is another tool in our toolbox that if everybody in Pennsylvania had that app, it would make the contact tracing so much easier because it could automatically alert people that they had been exposed. It wouldn't say by who, and it wouldn't say where, but it would let people know that they've been exposed so that they can seek the guidance from their medical provider. So it's just the reality of the situation that we're in. I know that we are hiring quickly to ramp up our team so that hopefully we can go back to just contacting everybody as we had been doing. And we will as possible as quick as possible.
Just a quick follow up on the app. The governor says 510,000 people have downloaded it again statewide. I'm guessing you don't have a regional breakdown on that. But again, is that in any way effective, that number, 500,000?
No, it's just not simply enough. In fact, if you have the app, when you open it up every day, and I check it every couple of days, it will tell you how many people have downloaded it. So you can keep an eye on it yourself, but it doesn't tell you where those people are. You know, if we had 500,000 people in Montgomery County that had downloaded that app, that would be a tremendous asset to us and be of enormous help. So again, I just encourage everyone to download it. The nice thing about the app is that it also is working seamlessly in the state of Delaware, New Jersey, and New York. So if there is someone that does, it would work in those states as well. So the 4 states are connected through the app. So really want to encourage people to download that app. It costs nothing. It does not collect personally identifying data. And it's a really simple thing that you can do to help our team out when it comes to contact tracing.
Thanks.
Thanks, Jim. Now we'll go to Deanna Durante from NBC10.
I just have a couple of follow-ups. You know, the state has said repeatedly it's not going back to red, yellow, green. Any plans for the county to look at what additional powers you have? I know when I've asked the question about shutdowns before, it's, well, we only have control of this. But as we saw last week, you were able to get the health department to use a 1955 law to use that school virtual closure or the virtual platform. So what else are you looking at, or can you look at, or what powers do you have as a county if it's solely left up to you to start shutting things down?
Yeah. Well, first of all, I want to point out that law is, I know it's old, but that is the code that covers pretty much all the county health departments. There haven't been a lot of updates or amendments to that law. So that's just the situation that we're in. But as we've talked about in the spring, the county has certain authority just day to day to regulate gatherings. I will remind everyone that we still have a 25-person indoor limit and a 250-person outdoor limit. We do have a mechanism for an entity or individuals to apply for a permit through the health department to have more people than that. So that is a way that we've been using very effectively to keep an eye on bigger events that have wanted to come into the county. We have always had, I do want to mention, don't have the ability to force them to open. I think I've gotten a lot of emails from parents asking us to open the schools. We don't have that power, not in Montgomery County. It's up to the school boards to make those decisions. We can regulate restaurants and other places of business. So we do have that authority day to day. And then during a public health emergency, which we are still under, which the state is still under, and which the federal government is still under, we do have some broader authority. And we do continue to look at what our contact tracing is showing us that would make the most difference if we could regulate those things. One of our biggest problems, and you've heard me say this many, many times, is youth sports. And our solicitors are still trying to understand whether or not we have the ability to regulate those.
To be naming the school districts that you say had school spread, and any of the businesses that you say that have had to be closed because of spread there?
No, we've left the school communication up to the school districts to communicate with their families. And I've alluded to some of the businesses like the ice hockey arenas, but no, we do not typically publish lists. I would just remind everyone, though, that restaurants have the option to self-certify through a Pennsylvania state program to increase their indoor capacity to 50%. And there is a website that shows which Montgomery County restaurants have done that. And if you go onto our data hub, there's a button about guidance. I think it's called County Guidance at the top of the page, and you can click through that to find restaurants that have self-certified for larger capacity.
So we won't know when the county goes in to shut something down because the business looked the other way and not having people wear masks and things like that.
Well, if there's a restaurant that you expected to be open that you find is closed, that might be a hint. But typically
or they went out of business.
Well, that's possible too. But I mean, if you knew they were open. So that is one way to keep an eye on it if it was a place that you regularly patronize. But we're not planning on publishing those lists. The reason is that at the first round, they're closed for 48 hours. And then if they are a repeat offender, then I think they're closed for either 1 or 2 weeks. So it's just an ongoing process, and it would be difficult to communicate that in a time-effective manner.
Okay, thank you.
Thank you. That concludes our questions for today.
All right, thank you, everyone. And again, just a reminder, our next briefing will be on Tuesday next week at 3 p.m.